Thank you for tuning in to the Health and Social Care Business Podcast. Here, we highlight the people and businesses making a real difference in the sector, from everyday challenges to big industry shifts. We explore the issues providers face and how experts and organizations are stepping up with practical solutions. Our goal is simple: to bring you relatable insights, real stories, and actionable advice to help you navigate and thrive in the business of health and social care. Good afternoon, everyone, and welcome to today's roundtable. I'm Obi, and I'm honored to be joined by a distinguished panel of sector leaders, advocates, and practitioners. We're here in response to the Prime Minister's Securing Britain's Future announcement. In both the speech and the accompanying papers, we hear lots of recurring themes: migration, skills, growth, fairness, and control. Migration, in particular, is dominating every conversation across the care sector right now. But what remains missing, yet again, is a grounded understanding of what these proposals mean for the care sector. So why are so many in care deeply concerned, even fearful? Because for social care providers, the care worker visa isn't just another workforce lever. It's about continuity, quality, and safety. In most sectors, if a staff member calls in sick, it's a problem. But in care, it's life or death. So today we reflect, unpack, and shape a values-driven response, one rooted in the realities of those who deliver every day. Joining this discussion is Kat Hall, the director of Bear Group and the organizer of the Providers Unite movement. The Providers Unite movement is a collective voice of care providers, frontline staff, unpaid carers, and supporters of care, standing together to demand respect, recognition, and real investment in the care sector. Kat is known for her unwavering commitment to highlighting the challenges and the triumphs of the frontline. We're also joined by Anna Knight, a chartered manager and the chief executive of the Dorset Care Association. With over 25 years of experience in the health and social care sector, Anna has worked across not-for-profits, private, and public sectors. And she has been instrumental in developing projects like Trusted Assessor Scheme, which has facilitated over 500 patients' assessments with no failed discharges. Also joining us is Palvi, co-founder and chief operating officer of Serene Care, an award-winning boutique care home operator specializing in dementia care. Palvi transitioned from a successful career in investment banking to revolutionize social care, emphasizing digital innovation and quality service delivery. And also joining us is Andrew Yamuyaro, Director and Principal Solicitor at Tan Law Solicitors. With extensive expertise in immigration, family, business, employment, and human rights law, to this conversation, Andrew brings a wealth of legal knowledge, particularly concerning the rights and responsibilities of migrant workers within the care sector. And finally, we have Dudley Sawyer, a health and business consultant at People's Care Services. He's also chair of registered managers at the London Care and Support Forum, LCAS, and this covers 15 London boroughs. He's also the co-chair of the Race Equality Reference Group at Skills for Care. Dudley is a passionate advocate for diversity, inclusion, and systemic change within the health and social care sector. Thank you all for being here today. So I'd like to start with you, Kat. I'd like to get some initial reactions. When you first heard the announcement, what was your initial reaction?
Oh, devastation, really. I was just shocked. I still am now, actually, to be quite honest, and I shouldn't be, with the amount of, headlines that are coming out all linked around the social care sector at the moment. But I was just absolutely devastated that the workforce that I worked so hard to bring in and that I'd actually saved my company, saved lives, saved multiple companies around the country, was now being deemed low skilled, replaceable by 5 million people that are working age on benefits. And that after everything they've done for us, built their homes here, left their families to come and support our families, all of that was at risk. So yeah, it was absolutely devastating. And we're still facing, the fear, the anxiety. I'm already seeing staff leaving They were already handing back sponsors and looking to go back home or to Canada or to Australia, America. We're already starting to see some of the impact that it's had. And then on the other side, I'm also seeing a massive influx of applications, people trying to get through quickly, just in case anything else changes. It's just been devastating through and through. And I think I held a meeting with my workforce on Friday, and I had to hold back the tears, really, because I had 100 international workers on the phone with me. I've got 156 to date. And they're all like, please, ma'am, what can you do to save me? What can you do to save my family? And I shouldn't be having these conversations with these people. They've come in and they've saved our families, they've saved our people, they've brought culture, they've contributed to the community, and now they're being told that they're going to be shut out, they're replaceable, they're low skilled. It's just unbelievable, and it's dangerous.
So Anna, I know that you work with a lot of providers in Dorset. Is this the same with the other providers that you work with?
Yeah, and what's really sad, kind of reiterating what Kat said, and I'm sure everybody on here can agree, we had a really challenging meeting on Thursday where we had 3 commissioners in tears, which is unheard of. Absolutely devastated the impact on the care sector, on their providers. There were providers on that call as well who were distraught because, these aren't just individuals. These are people who've become employees, friends, their families have become a part of our lives. Individuals who, when they could, have brought dependents over, their children are at school, they're part of the community. And, a sudden decision like that, the impact is absolutely horrific and badly thought out, delivered in a very disrespectful way and in quite an appalling fashion. And the cascade, both up and down, is shocking.
So how about you, Dudley? I know that, again, just to echo what Anna said, it's everybody. So in terms of the providers that you also work with, what are they saying? What are providers saying?
I think it's continuous change of the rules that have really impacted on the providers themselves. We used to, obviously, at first, the doors were open for them. Then they've had to deal with various changes around the UKVI and Home Office revoking licenses. They've also seen that they can't bring in their families. So what started out as really a good gesture for them to come over here to help and support our sort of the workforce, those who needed care, has almost been lost. And now it went from being, someone that they were looked upon as being their best sort of solutions, now has looked as if they're now burden on this country's workforce. I think that's the thing that has really disappointed a lot of the care workforce. And you're having a lot of reactions of, we're coming to do the work that a lot of people, homegrown sort of staff, aren't doing. We're actually here to support. We listened to what your needs were and we've come to do that. And think now to really see themselves as being a burden on society has really impacted upon them. And it's made them very uncertain. And as you said, many people are having conversations with staff and they're asking 101 questions. Can we stay? Can our family stay? What happens if we do this? And it's led to a lot of just confusion at the moment, which is really unhelpful.
Alvi, what is the disconnect between policymakers, central governments, and the front line? Because clearly there is one. We've heard from Anna, we've heard from Katz, we've heard from Dudley. Everybody's saying the same thing. Everyone is concerned. Everyone is talking about the values that migrant workers bring. So why are central government not taking this into consideration?
Well, they're not actually doing consultations. They're making these dramatic decisions without actually speaking to us in the sector. If we did this in the workforce, we would be completely annihilated. It would be against every rule. These policies are changing without the clear communication behind it, without the backing of what's actually going to happen. They're making announcements without all the information. It's causing so much anxiety and stress amongst everyone. And what's happening is that everyone's second guessing, and you can't have a situation where you're all just working out the rules. If you're going to change something, typically you would ask the people impacted, what do you think? How do we do it? Here's the time frame. These are the steps we're going to do. This is what we're going to announce. Everything needs a consultation. This feels like the pandemic again, where again it's like, as of tomorrow, you can't take people, you can't work in a care home unless you're vaccinated. Full stop. Oh, but we're going to change it now. Relatives don't need to be vaccinated. Full stop. Oh, we're going to expand that further and say, if you work for the NHS, you can. It's like these blanket rules keep changing without all the information. It's more a political thing as opposed to actually thinking about what's relevant to the care home and care sector. And that's the issue. There is a disconnect. However, like Kat and Anna and everyone said earlier, It's really worrying for our staff, and we're owners who are reading the same news. We're not part of this. We don't know. The government's not spoken to us. So, but yet we're meant to have the answers for our really scared workforce. But we're just doing the same thing that everyone else is doing and reading the news, reacting to the news. And I've got carers and I've got managers and I've got really senior people coming to me saying, does that mean now that I have to stay for 5 years or 10 years? I don't know. I have no idea. I'm reading the same news you're reading. Oh, okay. And now what happens if I'm a dependent? And now what happens to my family? What happens here? I genuinely don't know. And that's really scary because I'm now having to future, not only am I meant to counsel them, because it's really traumatizing. And, you know, I spoke to someone today who said to me, I feel really betrayed. I could have gone to any other country. I chose the UK because of certain reasons I wanted to come here. And now I want to leave. I'm looking to go to Australia, you know, as Kat was saying, Australia, Canada, because what's the point? I came here and now I'm told I'm worthless. But during the pandemic, when you needed someone, I came in, I left my family, you know, based on certain things that I thought was going to happen. And 4 or 5 years later, I'm being told that actually I'm low skilled, I'm not important, anyone can replace me. That's not fair. And
Yeah.
I've honestly felt so much hurt for her because she's like, you don't understand the sacrifices I've made to be here for these residents, for these staff. And they have made so many sacrifices. And she's like, and now I feel like I can be easily discarded and I'm a disposable person. Now, in any other scenario, if we said that in social care, that that's how our residents would be treating, you'd say that's not fair. So why are we doing that for our most vulnerable staff members? Why are we not giving them the same care, compassion that we would expect for anyone who's vulnerable?
Thank you for that. Thank you for shedding light on that. And I'd like to bring you in now. So just to respond to what Palvi said, this is not my words. I'm quoting what the Prime Minister says. He says, too many businesses have become reliant on migration, importing cheap labor, rather than investing in talent at home. So to respond to what Palvi said, this is what I believe that this is what the government is trying to do. So rather than listening or consulting with people like yourselves, it seems like the government's concerned that businesses are too reliant on quote unquote cheap labor. So as someone who works again with providers, how does that fit into this narrative? There's clearly, like I said earlier, a disconnect with what front lines are, what the emotions are around migrant workers and what the central government seems to think is best for Britain moving forward.
Well, firstly, how dare our care workers be described as cheap labour? You know, they are underpaid. All our care workers are underpaid. We desperately need to have individuals who can work for us. And this was, at the time, a very, very good solution. And it remains a very, very good solution. And we have had hundreds of brilliant individuals come into the care sector and join us. We haven't got access to individuals who want to come into the care sector, particularly young people. In terms of how it was delivered, it was very quick. It was slam dunked effectively. There were so many things that weren't considered at the time. So, you know, where were people going to live? How was the HR going to be managed? How are individuals going to open a bank account? How are we going to manage their well-being? And I know we're going to come on to our colleague from the legals, but, you know, initially when people started, just didn't have a clue how to even do it. Yeah. So in many ways, a lot of the providers that we work with went in blind. They paid lots of money for individuals to join them, invested in them, and wanted the absolute best for them. And, you know, this random statement that was made is just so wrong. I've said it before and I'll say it again. We are the fifth emergency service effectively. And our job is to prop up everybody else. And we are the ones that are being relied upon. And actually, we're the ones in many ways that just deliver and deliver and deliver. And we invest in these individuals and we care for these individuals. And at no point would any of us risk to cause damage to them. Yeah, we do know there's been some rogue providers, and all of us on here are ashamed and embarrassed that they have played that role within society. However, the people who came over to support us in the care sector, the majority of them have delivered a really, really good job. What I will also add to that is, where was CQC at the time? There was a point, and I'm sure some of us will agree on here, when you could just write CQC and say, I think of starting a care agency. Is that okay? Yeah, crack on. That's absolutely fine. And lots of individuals then applied for so many certificates of sponsorship without due diligence that was put in place. You know, people getting 300, 400, 500 licenses in one go. Where was the due diligence for that to happen, for those individuals to be protected? So actually, the catastrophic mess that has been created has not actually been created from us. It's been created by opening avenues that were people could abuse not the right sort of people that we want in our industry. And individuals who were so desperate to join us, and exactly as Palvi's just said, wanted to reach our values and the goals that we wanted, and felt that the UK was the right place to come to, and some really unkind individuals who abused that. So, what's happened is those brilliant people that have come over, who've done amazing work, who've come as a care worker and then become a senior, working their way up. There are people who've completed level 7s already in Dorset, who are going to be our future, are now absolutely terrified about what's going to happen to them. And the white paper, the discussions that are ever changing, as Kat says, every 10 minutes, we don't know, quite frankly, whether we're Arthur or Martha right now. So that statement is belittling, it's disrespectful, it's unkind. And the people that are here doing their absolute best for the people that we support, unfortunately, have become victims of just a total lack of communication, a total understanding of what we need. And actually, if we can't give that, what on earth is going to happen to the NHS and everybody's family and parents?
So we're going to talk later on about the systemic failure later. And I love that you touched upon that. Kat, I'd like to bring you back into this conversation. From your perspective as a provider, what has been misunderstood about how and why providers use this route? I know you've spoken so passionately about the need for the visa scheme and how it's been reduced to cheap labor. Yeah, Kat, I'd like to hear from you, please, with regards to what is being misunderstood about how and why providers use this route.
Yeah, well, I think certainly the Prime Minister's speech about cheap labour, I put a status, he hasn't actually got a clue the amount of investment that we have to put into these international workers, which we all did. We all had to put in additional training. I had translators. I put all mine through English classes, cooking classes. We really heavily invested, and we pay more to onboard an international worker than what we do to onboard and induct a British worker. Of course, we all want to hire British workers first. I've had my business for 20 years. Oh my God, 20 years, yeah. And I do everything. I go to colleges, I go to job centres. I've spent hundreds of thousands of pounds on Indeed, which again, I've been quite open about. It's a wasteland for benefit claimants. All we do is we get hundreds and hundreds of applications through, people pressing click so that they've applied for their 10 jobs a day, get an interview, and then they're still in receipt of benefits. They give me all the spiel on the phone. Yeah, I'm really caring. I really want to do this. And we're like, wow. And then we get to interview and it's like, well, I don't work weekends and I don't drive. And I really don't want to do personal care. Can I just do like the shopping bit? Do you mind if I just do like the domestics? I don't really want to touch anybody. We get, a lot of that. But apparently, out of these 5 million people, the majority of them are going to be fit for the job. I think a lot of it is ignorance, not speaking to us, just communicate with us, because there is other things that we can try and do and try and evidence. And certainly one of the rules that's always been there with the skilled worker visa is you've got to evidence that you're trying to get local staff. And we do. So before we put in any application for additional causes, I show them, right, here's 600 applicants I've done over a 4-week period. Out of those, I've taken on this percentage. This is what I've lost. And we evidence those as good providers. And what's happening now is the good providers are being penalised for that small majority of rogue, corrupt, fake companies that were formed to bring over their loved ones. I was listening to radio the other day and we had a chap on there that said his sister ran a bank and she set up a dom care agency just to get a visa license to bring him over, and his family members. And I mean, it was brilliant timing. I'm sure they were paid to, he was paid to attend or something. But these are the sort of providers that should be penalised. I've just been inspected. I've got an A-rated inspection with the Home Office, and that should be used to ensure that my sponsor licence stays open. It shouldn't be accusing me of trying to get cheap labour, not upskilling. I funded nearly £500,000 in getting my staff through diplomas, right through from 3 to 7, they are some of my most skilled workforce. So the fact that they're classed as cheap labour, that the government's certainly educating, and they need to come sit and talk to us, speak to my international staff, because my international staff want to stay for 10 years. They want to do caring, they want to upskill, they want to do some sort of clinical training, and they're going on about the training pathways. But again, in the UK, it's very hard to get somebody that's not lived in the country for over 2 years onto a diploma. So that it's very difficult to get government funding for that. So we funded that for them because we believe in them, we invested in them. And we would do this with the British workforce. But the truth is, we haven't got a British workforce queuing up at the door, ready to come in. And now what the government's done, they've increased visas, our annual visa cost by 32%. They've now said what you've got to do is pay international workers more than you pay British workers, because we know in the care sector at the moment, with all the other hikes that are going up, a lot of providers are only paying a minimum wage now, which is 12.21, and you've got the internationals that have gone up to 12.82, I want to say, or 89, I can't remember off the top of my head. So now we're dividing them, and we're causing some ants between the British workers and the international workers. And as if that was the other way round, all hell would break loose. So it just seems at the moment the government have just woken up one morning and they're like, how can we completely sabotage the care sector? And they're doing a really good job of it at the moment.
So Kat, you mentioned from what you've just described about how you've had to upskill your staff when they came in, because when you're working with migrant workers, there are lots of hidden costs and skills and training.
Mm-hmm.
So when the government talks about raising skills threshold, talks about moving care roles to degree level, what does that mean? Because as someone who works in the sector already, you feel like lots of even the migrant workers, some of them already, they are degree holders.
Every single one of them has got a degree. Every single, because I just wanted to run that audit just to prove a point. So every single one of my workers has got a degree. They've all got British qualifications now as well. 90% of mine come actually over on a student visa. So they'd already attended universities all around the country, and they come to me more skilled than any British worker comes to me, unless they've been in the care sector here for a long time, which again, we're not getting that come through the front door. And if they haven't had some education in the UK, they've been nurse aides in their own countries, or they're doctors, or they're nurses. We went over to India to interview everybody. So we didn't just have CVs through and be, oh yeah, we'll take anyone, we're just that desperate. We did it the right way, and we made sure they had 3 years of experience. We did an English test with them before they come over. We made sure people we were bringing over were the right people for our company. And I can sit here and say all the providers that I know have international workers have done the same thing. So the fact that they're labelled as low skill is just not factual at all. It might be relevant for some of those rogue companies, absolutely. And if we look at the displaced worker list at the moment, I'm being forced to have to access that list now because I'm not allowed to bring anybody in, which is quite right. And I do want anyone that's been messed about here to have an opportunity to get a good employer. However, what I'm finding with these displaced workers, they were brought over by rogue companies. They wasn't interviewed. They wasn't qualified checked. They have no references. Some of them cannot speak English. So I'm sat here now, and actually that availability, that pool of availability, you're probably looking, personally, I think you're probably looking at about 10%. Most of them are non-drivers as well. So for community care, it's no good for us. And again, a high percentage of it is a male workforce, which, I've got a very large male workforce, but a lot of the work that's available in the market in dom care at the moment is all female only complex care. So again, out of that pool of staff, it's a lot of them are not fit for social care. So the government's also saying, okay, if they can't get a job in here, they can switch their visa and go work down another route. And I'm thinking, hang on a minute. I'm quite confident that all my staff are going to stay, but now we're giving them another option to potentially destabilize the market even more. It just seems everything is a mess at the moment. They're not engaging with the frontline providers. There's a lot of top hats speaking here. No, people need to come and engage with us and speak to the outstanding providers, the A-rated providers, and the sector leaders that are on the front line. That's what actually needs to happen here.
So you spoke about English speaking. So Paoli, I'd like to bring you into this conversation as we move into the next segment. So the Prime Minister talks about linking migration to skills and training. From your experience, are providers being supported to upskill their workforce? Because this is another thing that was mentioned, skills, skills, skills. What was one of the themes around the changes? So I could imagine that, speaking about hitting costs, this has already been done. But up until now, is there any I don't know if you've read the white papers or what has been said about supporting providers and what should be taken into consideration when it comes to supporting providers with skills development?
So I think Kat already stressed the point that historically, if you haven't been in this country long enough, you can't get the training funded, which means that as providers, we've been paid. So all these overseas workers that we've been bringing in, similar to Kat, I did a lot of student visas and we couldn't get funding for them. So we've had to pay for their MVQs and upskilling and stuff. And that's something that we just had to do because it's the right thing to do. We're not here to bring people in just to have them without the right training. It's a really interesting because one of the biggest issues is we have too much training in the sector. It's repetitive training, it's constant training. We have so much training that my staff are exhausted with repeating the same fire training, the same moving and handling training. It's all of that. So we try and move it more to competency based to say how much training do we actually need. So we can do competency based. But again, there's a big disparity about what is actually expected. There's a lot of confusion for providers about what is CQC wanting, what is it that the local authority want, what is it that, we're meant to do because Skills for Care have suggested it. And there's all of that confusion. Plus you've got different funding pots, also based on the postcode lottery. Some local authorities fund it, some don't. Some, will pay for things, others won't. Ultimately, we all know that the more MVQs and training we can give people, the better. But again, we need to give people time to do all this training around their work. The work is not unskilled. It is difficult. It's hard. They're working really long hours shifts and then expecting them on top of that to do lots of mandatory training, MVQ training, for us to then pay for it, for them to meet their assessors. But what happens when people call in sick? So they're then picking up shifts. It's like a proper juggling act constantly. And I don't think anyone understands. It's just saying let's upskill the sector. It's not as simple as that because we are upskilling the sector. But what we're not doing is looking at the whole picture of how much training are we actually bombarding with people with, but how much of it's actually relevant, how much of it's fair and funded. So, how there's the split between, the rate of pay people are giving to domestic workers versus overseas workers. It's also the same with the gap in terms of the training that's being offered. Something that I've spoken to Dudley about a number of times is about the training he offers, which is amazing for pastoral workers, is because we have to give more. We found a big gap when staff members came in from overseas, even if they were students, that their understanding was very different. So we've actually put in more money, more training, and no one's funding this. And that's the problem. We're not getting funding for all this extra training we're doing. Kat was mentioning all the training she's had to do with cooking and driving lessons and all of those sort of things. Those are the hidden things that as providers we have to do, but no one's talking about it because we're just trying to do the right thing for our staff. I mean, I don't run a dom care agency, so for me, it's not an issue in terms of whether you drive or not, as long as you can take a bus into the care home. So it's a completely different, different for me. But that's the point. There's blanket policies that are very differently impacting different sectors of care. So dom care will be impacted different to care homes. Residential will be impacted different to nursing. The fact is the services are relying on nurses to come from overseas. What happens now? Where do we get those nurses from now if there's going to be changes?
Clearly, the solution for the sector is not upskilling. And I'd like to bring you into this conversation now. From your perspective, what should the government be talking about? Because we understand that the government is concerned. However, the care sector relies on this. One of the solutions was upskilling. We've heard from Palvi, we've heard from Kat about the numerous training, upskilling, and all of that's been done. What should the government be talking about?
I mean, if you refer back to Kat saying, well, it didn't audit and everyone's got a degree, that is the reality. I was just doing kind of mental audit. I'm working with providers who've got paramedics, physios, dentists, nurses, doctors. So, we are highly skilled and the people who are joining us are highly skilled. Actually, they should be having a really good hard look at what we've got, investing more in that, not expecting us to invest more. And, there are actually the most important part here is values. people have to have the right values to work in care. And what we need to be doing is being able to have some money to reinvest in values potentially. So there are people who were brought over exactly as Palvi and Kat were saying, who've become displaced not through their own fault, who really do want to be here. And if we speak to them, some of them have got really great values, and we invest in learning better English. So, we all know this example, but I'll put it out there anyway. Palvi wants to spend a penny. Someone's very confused by that. So they're trying to get a penny out of Palvi's pocket. She actually needs to go to the toilet. Dudley has no clue what to do with the bacon sandwich, so he gives it to somebody raw inside 2 pieces of bread. Actually, we need to be upskilling in that kind of way to give the people that we support the absolute best care they can possibly have to keep them safe and to have fun. And the other thing, trying to open a bank account when you've never been in the UK before, something as basic as that, we need to make that far more easy. So there are lots of things that we need to be doing. And a lot of people did a lot of training before they even came over here so that we would want to work with them as much as we possibly can. So what the government needs to do is say exactly what everyone on here, so this is probably the most highly trained sector. We are broken with the amount of training we have to do. We probably don't need to do as much of it. And quite frankly, I'd really like to see some of the people in local authorities doing a bit more training themselves before they come down on us. And the same goes for CQC. Is everybody at CQC as trained as we are? And, when final part from me, because as we all know, you describe me as passionate, it actually costs us money when somebody manages to go to a new level in their career. So if a carer becomes a senior, we have to pay for a new visa, an upskill on that. So actually, what needs to be looked at is what money do we need to help these people stay with us and continue to live the best possible work. Rant over.
Thank you, Anna. Let's shift the focus towards legal. Like Kat said earlier, and like you also echoed, Palvi and Anna, migrant workers are scared. They are concerned. They don't know what next. So, Andrew, I'd like to bring you into the conversation now. In terms of the legal space, what is the current atmosphere like? Do you get calls from migrant workers?
Thank you so much, Obi. In terms of the legal, I've had my phone call buzzing all the time because I'm getting phone calls from students, academic institutions, employers across the board, and particularly employers in the social care, dependents of people that are already in the UK, and people that almost getting to the stage of applying for their settlement, who are afraid that the settlement period might be increased from 5 years to 10 years, and people that are almost ready to receive their citizenship. They're also afraid that the citizenship period might also be increased from 12 months at the moment to whatever period that is going to be mentioned by the government. So all the proposed changes in the white paper have had people really anxious and scared for whatever is going to happen. They're not settled as to the correct position as we speak. So there's a lot of uncertainty that is happening amongst people from different walks of life. Even the issue of the English test, Kate was talking about having a lot of people that are highly skilled in different ways and so forth, but the Home Office is still saying they're not skilled, so they want to change the English test. They want to change their life in the UK. The life in the UK test, if you were to give it to an ordinary British person on the street, most people might not even be able to answer 50% of those questions. So how hard are they going to make it? Because it's already difficult as it is. And in my view, most of the questions are not even relevant for ordinary life. I do understand where the government is coming from, that they want to make sure that people integrate and people belong to the community and contribute to the economy one way or the other, which is what a lot of people that have come on the skilled worker are doing. They are working, they are paying their taxes, they're covering jobs that have got shortages, also bringing innovation and cultural enrichment, making social contributions. So a short answer to your question, there is a lot of anxiety that is out there on the streets because people don't really know what is going to happen to their lives. This is a major change since 2012 when Theresa May was Prime Minister.
Yeah, so also, as Kat said earlier, when the announcement was made, staff members were asking, what is my future here in Britain? What do I have to start doing? Do I have to start getting my family and moving back home? So in terms of a legal perspective, for a carer who is out there, a migrant worker, rather, who is scared, is there something that you could say to them to perhaps make them feel less scared from a legal perspective. Also, previously, we know that with the providers, as Anna said, when the care visa was put out, there was lots of miscommunication and lots of things that weren't understood in that process. And now it's the migrant workers who are paying that price. So from that lack of understanding, lots of rogue employers, of course, capitalize on that. And now it's the migrant workers who are paying the price. So for a migrant worker who is out there, perhaps maybe PALVI staff, just migrant workers in general, a message to them to make them understand where they are in terms of legally, like their position in the country.
Okay, so a white paper is part of the process in which the government introduces legislation. So we are still at the consultative stages. Although we are still at the consultative stages, the chances are that they're going to implement most of what they've proposed. As you would know, this is connected to the political situation in the country at the moment, with reform having been voted into most local authority elections recently. So what the employees need to do, in my view, is that they need to be reactive to the proposed implementations that have been done by the government. So they need to communicate with their MPs to have their views be heard. They need to do online petitions if they can, or to sign online petitions. They need to talk to their neighbors, because their neighbors might not really understand what is happening in their lives, because they're just being influenced by the mainstream media and the politicians. So the neighbors, the community can be good lobbyists for the employees as well, and also comment on their own social medias and so forth. So instead of the employees just sitting back and just crying in their seats, they need to be proactive and let their voices be heard, even talking to local media as well where they are. And I'm glad with what the Providers Unite, which Kate is very active. They are one of the groups, and the announcements, I always see them in there. It's very good because the employers are taking action. There's going to be the hashtag day. Is it tomorrow when there's the hashtag day that you're going to have? So
yes, it is tomorrow.
Yeah, so the social hashtag, those are the things that we need to be doing. The employers, the employees getting together, having our voices be heard by the government, and everyone else was being impacted. And for those ones who are almost close to their settlement, they might have to consider doing the tests before they've been changed, like Life in the UK, English test. The challenge with the English test at the moment is that it expires after 2 years. So there might be no point in trying to do it. But the Life in the UK test, it doesn't an expiry date, so it might be valid even in the future when they're going to be using it as well. So those are some of the things that I think the employees need to do to make sure that their voices are also heard by the government and hopefully influence the position of the government.
Can I just add into that? Thank you.
Yes, please.
So on Providers Unite website, we have some template letters. This is for client, family members, staff to write to their MPs. We've got all the list of the how to find your MP, what to say, all about their drop-in clinics. So those resources are there. And I've certainly had, and I mean hundreds of international workers message me, and I've signposted them all. And I think today also in the group, I've seen that a nurse, I think it's a nurse in the hospital, started a petition around the whole white paper. And they want it not to change to 10 years, keep it at 5 years, don't make us go home. Everything we're talking about today, there is a live petition, which I have signed last night. It's on change.org, and it's been led by an employee, which I think is just amazing. That's the one we need to be supporting. And I will share that one again on my socials later, because I haven't had a chance to catch up on it. So those sort of things are happening. That's such great advice. And I think what I've been saying to my employees is I'm with you, and I am fighting with you side by side. We are united. We are a family, and I will go down. I'm going down with you anyway, because if I can't keep you, I have no business to operate anymore, because you are my workforce. This is our world together. So
I was just going to add as well, if it's okay, that
Yes,
a lot of providers are reaching us and saying, we're reaching out to the Andrews as well, the legals, because we need to know what's going to happen. So they're now spending more money in a blind panic. And we're kind of saying, look, there's all the care associations, all the different associations, we're all here to help. Just wait for a bit. But a classic example is a young lady who rang us on Friday evening distraught because on the birth certificates of both of her children, there isn't a father's name. And that is now stopping her from moving further forward. And she's traumatized to the point where she thought the children were going to be sent home without her. So we are causing so much distress and unhappiness for individuals who come here to help us, providers who've taken on, red carpet delivery of care, now having to spend even more money to feel secure. So the impact of this bomb, the cascades are monumental, and all of us on here, we just feel so awful for the way it's been delivered and just the lack of care, really.
And they delivered this message on International Nurses Day, which at the time it just couldn't have been, any worse, really. They just are not thinking anything through at all. So
just before you go, I was going to ask for just a statement from everybody, your one word to the government. So you could just give me your one word to the government as part of our prescriptive segment.
I'll be very polite and I will just say, we're here, Providers Unite, we're here, we're ready to talk. Any time of day, night, we're here, we are ready. Just please come and hear us, listen to us, have discussions with us and trust us. We know what's best for the sector. We know how to make it work like clockwork. We do that. We do that all the time. And so just value us, trust us, and believe that what we're saying is what will help save lives, the NHS and our communities.
Anna mentioned earlier with regards to the broken system, when the care worker visa was initially released, I touched upon this earlier, the actual design of the system is what led to this failure, and now migrant workers are having to pay for it. So Dudley, I know you've been quiet in this conversation, so I'd like to bring you in terms of talking about how we're going to move forward. If things could be done differently, what should be done differently, especially now that we're talking about reforms?
Thank you very much. I've been listening, wonderfully for all the sort of things that have been said. I think I want to just set the scene, and the tone is that this is a seismic sort of time we're dealing with in regards to having and supporting a sector which was in much need of a workforce to help them. I also want people to think back before probably our time when we talk about the Windrush generation, where the government had called upon those from overseas to come and support a system that was broken and in much need of support and help. And it really helped to save things like the NHS as well. So we have history of this. And once again, we've come back again now to support and look for social care, which once again is in much need of support. And working in the sector, I think it would be wonderful to have homegrown talent, those who are under 25, those from different sectors, but we know it's very difficult. And we're looking at certain skills, and I think Anna mentioned as well before, where the skill set are not just skill sets of learning how to care. Actually, it's something we talk about caring for someone. Those are sort of the values that we look for when we come into the working environment, especially a lot of those who've come from overseas or internationally are used to probably living with their parents, grandparents, looking after them. So a lot of that skill set is natural to them. So actually having to train that, we don't have to. It's just about teach them how to upskill them, as I say, for systems. And so those will be the things that will be the starting point. So if we look at solutions, one thing I've always struggled with is that if we're going to train people, especially in social care, there isn't a national element of those coming into sort of international recruitment. You'll get some good training in one part of the country, another good part of training, another part. There's no universal training that's set out. The NHS has a lot of gold standards when they come to bringing their staff into the country. But for social care, there isn't anything set in stone. There should be probably some form of natural training, which can be done prior to them coming in, but also when they come in as well. So that will be very helpful. I would think about that as well. And the other point, I think, which is important, if we're going to make a difference, have a round table, have all the stakeholders in the room that are going to be there, that are going to make a difference, not just someone from a care home. You've got someone from dom care. I also agree you should have the likes of KVI, have the Home Office, you can have HMRC, DHSA, all of these people are in the room, so we all know how to move forward. You're going to get the sad stories, unfortunately, a lot of individuals who've come here, they're trapped, they don't know what to do, and it's forever changing. If there was a clear guidance and pathway of what people were going to expect, we would be in a better place. And this is not just from training, it's understanding that there's going to be lots of support needed, required, not just from pastoral care. We're talking about the mental health and well-being of families. And because I always say, we always think about people on 9 to 5, but what happens from 5 till 9 in the morning. How do they support? How do they live? How do they eat? If there's no recourse of public funding, what are they going to do? How are they supported and where they live? So we've got to look at the bigger issue here and how can we support them? It's not just saying we want to stop people from coming to the country. They're here now. So what is the plan? What's the action? Last point I want to make is that social care always gets looked and frowned upon as the worst place to work in. Yet we've just decided to bring people into this country to help us because we're desperate. And then we've now showed anyone who wants to come into social care who's homegrown, why would they want to work in social care when we're not even saying the great things and values about an actual sort of workforce which are skilled yet? So how will that be appealing? We want to get rid of those who we've asked to come here. We don't want them to work anymore. We really want those who desperately to want to find work, come and work for us. If you really want to get a PR job going around, really, really value the workers that are here, upskill them, showcase how wonderful a sector is. And I think for me, it's about coming together, the right people in the room, having a sort of national sort of training that everyone can learn and see. And so we really move forward. Otherwise, we're just going to be always 2 steps forward, 5 steps back. And that would be my sort of part that I'd like to share with this.
Anna, as Dudley was speaking, I could see you nodding along in agreement. So please, what would you like to add to that?
You know what? I'm going to slightly flip it on his head. I could not agree more with Dudley. I think all of us would, but I'm going to chuck in a little of a success bomb here because I think sometimes we have to find some positives in these negatives, don't we? So about 2 years ago, a young gentleman from India started working in a care home in Bournemouth, and he has worked like a trooper. He was offered the opportunity to be a senior. He said, no, good as I am. I like my job, happy with what I'm doing. Anyway, about 6 months ago, he bought his mum and dad a property in their village. And he went back to India to give it to them. And the entire care home watched it as he handed over the keys. And that is when it works really, really well. And he was really well trained. He knew what he wanted to do. He has worked really hard to make mum proud. He'd already got a degree. I would want him looking after me. He's one of the kindest, nicest, sweetest people. But the point is, when it works, it works.
Yeah.
But he is now at threat. The parents' property potential is now at threat because nobody has sat down and thought all of this through. So yes, what we need is everybody sat around the table, including people like him going, oh, this is what happened to me because it worked. People it didn't go quite so well going, this is where it could have been better. And people who were brought in by the few rogue care providers who quite frankly made us all look horrific. And we're not. And that's what we need to change.
Thank you, Anna. Pavel, would you like to add to that?
Yeah, thank you so much. Everything I've heard is just fantastic. It's exactly how I'm feeling. And again, it reminds me of why I love this sector. Because again, when you put all the right people in the right room, we're all saying the same thing. We're just saying it in different places, different ways, different models.
Absolutely.
The thing is, we're having the same conversations, but now I don't feel lonely anymore. Again, because I know there's a support network out there of people feeling exactly the same thing. And I think that's the big thing. Social care does work if you put us all together, working collaboratively together, supporting each other with ideas and inspiring each other. It feels like I'm constantly running a marathon and then I'm always getting hurdles thrown at me. At every point, there's an obstacle, new obstacle, new obstacle. If you told me 12 years ago when I came into being a care home provider that every 6 months, every 3 months, every year, there'll be some new thing to navigate. Do you remember the pandemic, that minor thing? Do you remember the NI thing? Do you remember all the immigration? Do you remember those minor things?
It's an endless list.
Yeah, those small things that other industries don't need to navigate, but we have to not only navigate those things more than any other industry, but it also, we're overly regulated on, CQC and all the issues there. And it's like, there's only so much resilience you can expect from a sector. We're all trying so hard and it just becomes very demoralizing as a sector when we're trying so hard to help the most vulnerable in society. And rather than having the support we need, we're always having to firefight. And we need to stop firefighting. We just need to be focusing on why we got in this sector, and that's to help those with dementia, those with challenging behavior, those who are vulnerable to live their best life. And that's it. That should be the only thing I should be focusing on.
Harvey, the reason I asked all of you amazing sector leaders to come and have this conversation is we need to hear from people who are in the sector. And I know lots of people are constantly talking, but when they hear this conversation collectively as one unified voice, the message is clearer. So thank you guys so much for your contributions. Before we go, because I know all of you are so busy, and thank you for your amazing contributions, I'd just like to ask one thing of everybody. In just one final sentence, what would be your ask to the government right now? So we know what the conversations are in terms of migrant workers, endless increases like you've just articulated, Palvi. What would be your one ask as someone who is in the sector to the government, just following the same structure as the segments, if we could just go in that order?
Yeah, from my perspective, I would love for anyone to come and spend 6 months in a care home. Not one day for a photo op. I just want you to come and work in a care home for 6 months. Go put your relative in a care home for 6 months and then have the conversation if the decisions you're making still are the ones you stand by.
That's a great ask.
Just a mind, that small point. You can come for free. I don't mind. Let's try 6 months.
Anna, how are you going to follow that up?
Actually, I'm going to follow it up with something really quite critical. Imagine if your loved one was dying, it was a palliative situation and it was end of life. How would you feel if there were not enough staff to care for that person and they didn't die with dignity and respect?
How do you follow that?
Do you know, I actually was thinking, it's not my volume. I just literally, when you said that, that is a reality, and that is the reality of care. I was actually imagining myself in that situation. That's why I went silent. And that also is a different ask, but it's also the realities.
It is an absolute fact. And the reality is, this is not just in the care sector. We have got hospitals calling the Care Association saying, we can't keep our HCAs on. Can you help us find them jobs? So people, be real, because this is a genuine fact. I didn't just say that for impact. It's real, and all of us nodded.
Yeah,
it's true. Everything you just said is so true, and it's scary. And I don't think everyone's understanding the consequences of every decision they're making, the real consequences.
Absolutely. And sometimes I find when people talk about care, it's just a number, but people forget that care, it directly links with lives. That being said, Andrew, from a legal perspective, what would be your ask to the government right now?
If and when the government is going to implement what they've proposed, I say to them they need to consider putting a transition arrangement for people that are already in the UK, that if whatever they're going to decide will impact people that are going to come after, so they don't have to retrospectively affect people that are already in the UK. For example, people came to the UK with a legitimate expectation that they're going to go on a 5-year route and get their settlement. They came with a legitimate expectation that they're going to do the current English test and qualify as a British citizen after 12 months of indefinite leave to remain. So that should be applicable to them, like they did last time. I think it was in March 20 this year and last year, when they were saying for those people already in the country, they can bring their dependents, but those coming after the date, they cannot. But in this case, it looks like they're not going to put any transition. They just want to affect current people and anyone coming to the country again, which I think is unfair, it's irrational, and should be challenged in any court of law. So they have to consider giving the current people the transitional arrangements so that they will proceed with their current route.
Thank you for that. And then finally, Dudley.
Thank you very much. I think it's been a great session. I would like to say I'm very solution focused, and I think I'm tired. I hear this word constantly, the government that. I think it would be great to have something which sits outside of the government, which is really about the sector, a task force or a round table, which takes in all of the stakeholders in, not just from the political angle. We're talking about the well-being of the staff. We're talking about having a care worker on board, the mental health, the pastoral care, having everything. So it doesn't mean if there's a change of government, all of a sudden it's the flavour of the month and it's removed. Something which is beyond and sits outside of the political scope, which has an impact from every party, every stakeholder involved with this. So that means that it only benefits the whole sector and the end user who's being cared for. And for me, that's hugely important as well.
Well, on that note, I'd like to say a huge thank you to all of you for your time, and thank you. Enjoy this episode. We would love to hear from you. Let us know what about this episode you liked and how we can improve. Join our growing community of providers and carers who are learning new processes and technology, discovering proven best practices, growing through insights from industry experts, all from people creating real practical solutions in care. This is the Health and Social Care Business Podcast.